This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis, whose team of pet lovers, scientists, veterinarians, and more have dedicated over 70 years to advancing pet health.
Your call has been forwarded to an automatic voice message system.
Hannah Shaw
is not available. At the tone, please record your message.
Hi Hannah, this is Mike from Denver. My dog Marley has been having an upset stomach off and on for months. We've tried switching foods, but nothing really sticks. How do I know if it's just sensitive digestion or something more serious?
If you have ever dealt with a cat or dog who's had an upset stomach, you know just how stressful and, let's be honest, messy it can be. Is it something they ate? Is it stress? Is it something more serious? As a kitten and puppy rescuer, GI health is something I am constantly navigating. And with so many different causes, it's really important to work with a veterinary team to help get to the bottom of what is really going on. So that's what we're going to do today. We are diving into gastrointestinal issues, which are often tough to spot and sometimes difficult to manage. Today, our goal is to make those things a little bit more digestible. For this conversation, I'm joined by two incredible guests, Dr. Carl Winch, who is the Senior Manager of Veterinary Relations at Banfield Pet Hospital, and Kayla Peters, a credentialed veterinary technician and community programs coordinator at Banfield Foundation. Together, they will share their expertise and what we can do to prevent, recognize, and treat digestive issues. Kayla and Carl, thank you so much for being here.
Thanks for having us.
Yeah, so happy to be here.
Before we dive in, I'd love to just get to know you both a little bit better. I would love to hear about any animals you have at home. Kayla, I heard that you have 2 dogs.
I do. I have 2 Rottweilers, both named after coffee. So we currently have Java Bean and Brewer. And so they're absolutely incredible dogs. We love them so much, super loyal, a little tough, but I wouldn't have it any other way.
They sound adorable. I love those names. And there's a lot of different names that you could do in that theme. So I predict more dogs in your future. Dr. Carl, do you have any animals at home?
Of course I do. And I love the teaming with a theme for names, but I did not do that. I've got 2 cats, James and Simon, and a dog as well, who's actually here with me. He's lying on the floor being good for the moment, so hopefully he stays that way. But his full name is Archibald Peregrine Bartholomew. He's a border terrier, so the true terrier, sometimes it is an all points bulletin, so APB seems to fit.
I personally love the names of your animals, and I feel like you do have a theme. It's like proper human names, which I adore. So today we are talking about digestive health. This is a topic that I think is really misunderstood and also often downplayed, I think, by people. I hear a lot of people say things like, well, my cat vomits a lot, but that's just like kind of what cats do, right? So Kayla, I want to start with you. You talk with a lot of people who are bringing in animals. Do you ever hear people say something that they think is normal that you think is a red flag?
Any type of GI upset is, I wouldn't say full red flag, but definitely should be a focus point on people. So I think, again, very commonly with cats, people are like, oh yeah, he throws up like once or twice a week. And I think people are prone to thinking that's normal, but that could be a sign of something a little bit deeper. So any type of GI upset, whether it's simple as, a little bit of lip licking, seeming like they're nauseous for some reason, all the way up to, consistent vomiting or diarrhea should always kind of be monitored and looked into.
Yeah, I appreciate that. And you mentioned lip licking. I think that's something people don't even know about. So is nausea ever something that is just normal for cats or dogs?
I would never say it's normal. There's definitely a reason behind why they're nauseous. Whether or not that makes it, emergent versus non-emergent, is to be looked into, but definitely always something that should be noticed and, checked off the box of something might be a little funky there.
Mm-hmm. Dr. Carl, there's obviously so many different reasons that a cat or dog could be having an upset stomach. We are going to get into some of those more deeply, but I'm wondering if you can give us kind of a big picture to start. What are some of the most common reasons that you see for GI distress in cats and dogs? And does it look different in cats than it does in dogs?
That is a great question. And I love what Kayla said about, it's not normal. I mean, the most common reason we tend to hear for about any kind of GI upset is because there's been some change to their diet. And that can also be changes to treats, sometimes different treats. Maybe it's like, oh, you know, some pet store has this new brand of treat that's right near the front. You're like, I'm going to give that a try. It looks like cupcakes, or it looks like something I would like. Our pets' digestive systems aren't quite designed for this variety and this change. But the biggest difference I would say between the two, and I know we're going to get into this a little bit later as well, is, obviously our dogs, they really explore their world with their mouth. And so there are a lot of things that go in there. And so some things agree with them, some things don't. Cats are also very susceptible to stress. So changes in their routine and things like that can really cause upsets to their digestive tract.
Yeah. And can you talk about what role age plays in any of this? Do you notice that there are differences in the GI issues that are common for younger animals versus seniors? Is there a life stage component to what you see in GI health?
Yeah, for sure. Yeah, when we see our younger animals, and our younger animals are still developing their immune systems. And so they're coming into contact things that they've maybe never come into contact before, and their body is trying to decide how to react to that. So we tend to see more kind of parasites, maybe viruses in younger pets. Older pets, we tend to see GI issues because of age-related changes within the body. They've become less tolerant, or they've developed more sensitivities towards certain ingredients, or there's another process going on affecting other organs that then have a knock-on effect on the GI system. And so there is a difference between, if a puppy was to come in with vomiting and diarrhea, I'm going to more be thinking, okay, probably some intestinal worms or something like that, or gotten into something because puppies eat everything. Older pets, they come in with vomiting, diarrhea. I'm going to be thinking more, it might be a food sensitivity, or there's something else going on internally that I need to dive into.
Sure. So I work on the young end of the spectrum. I work with newborn puppies and kittens and the people who foster them. And one thing I find myself constantly saying is just because diarrhea is common does not mean that it is normal. I would love to hear both of you kind of expand on that a little bit, on why this is a big deal for young animals, especially for new adopters that maybe are, bringing in a new kitten or puppy and they think, well, you're a baby, you're going to have diarrhea. Kayla, why does that happen so much in young animals, and why is it a big deal?
So I would say, again, the reasoning as to why it happens in young animals, the list could be endless, but especially those that are adopting, young dogs from a shelter, or they just got their puppy from somewhere. Stress is going to play a huge factor. It's like a lot of unfamiliarity. A lot of times, too, when you first get a dog, there's a big food switch. So some places are wonderful and they're able to, explain this is the food they've been on. This is, the proper way to transition it. Here's some food to get you through. A lot of the times that's not necessarily the case. And so you hard switch them to a different diet. So that's always going to be an issue. Another thing that I think could play a big factor and is a huge watch out for young dogs is if they've been vaccinated or not yet, because that brings parvo into the situation. And so parvo is definitely something that, starts maybe some just, GI upset, lethargy, vomiting, diarrhea, not doing 100%, and can turn very emergent very, very quickly. And so, these 8-week-old puppies, maybe they haven't had like that many vaccines, if any. So definitely that would be a big watch out for me too. So any type of diarrhea in a small dog. They also get dehydrated really fast just because, diarrhea in a little guy, he's had it 3-4 times throughout the day. He doesn't want to eat. He's not drinking a whole lot just because he's a stinky puppy. Definitely is not great either. Can be emergent pretty quick versus in some of our other dogs.
So one of the most common culprits is parasites. And I think that a lot of people believe that if they're not seeing worms with their own 2 eyes, that there's no need to be concerned. Can you talk about why that is not the case, and how some of the parasites these cats and dogs can have are not going to be visible to the naked eye?
I can jump in with that. I love this question, because I feel like I talk about this all the time, because people are like, why are we doing fecal tests? Why am I going to pay for this? I don't see anything in their poos. It can't possibly be worms. And I say, well, what you're not seeing are the eggs. And that's what we're looking for. Generally, we're not going to see worms in their stools because the worms are living up in the intestines. And so it's just the microscopic eggs that you need a microscope to be able to see. Now, the difference there is with tapeworms. And that you're going to tend to see the tapeworm segments. And those are those little bits of rice that look like rice in their stools. And those come from fleas. So that usually is a sign that we have a second problem as well. And so I always tell people it's worth running these fecals because we can get an idea of what's going on internally. The other thing I would bring up is there are some parasites that puppies and kittens can get that can also be transmitted to humans. And so that's why it's important to also look for these things. And so I always tell the story like roundworms in dogs and puppies. Those can be picked up by kids. And this is a good reason why a lot of playgrounds don't allow pets on the playground. Because if you think about when you go out and you're like, when I clean up after my dog, I clean everything up, everything, I pick it all up. You're never going to get 100% of what's there. And these roundworm eggs survive so well in the environment. And then they sit on those blades of grass. Kids come running around barefoot or other dogs come walking around. Those eggs stick to their fur. They then stick their hands or their feet in their mouth. And that's how that gets transmitted. And so being able to kind of be aware of what's there and the risk to just the public health as well is important.
Yeah, I really am glad that you mentioned fecal testing. I'm a huge proponent of fecal testing because, like you say, so much of what is happening internally is not something that you can see. Kayla, do you want to add anything about kind of some of the parasites that are not even worms that people might not know? Things like coccidia, giardia that can be really common and that you cannot see.
Yeah, I would say I think more commonly people, hear giardia and that's something they think about because, you hear about it in people sometimes with like water sources and everything. And so I think people underestimate the ability of giardia. And so, I think it's easy for people. A dog comes in, we test them for giardia, they're positive. People are like, oh, we'll just deworm them. It's going to be great. Move on. And people forget the importance of actually cleaning the environment post being diagnosed with a worm, just because as much as we wish it was just a one and done type of situation, those worms, those eggs, those bacteria love to hang on to, as Carl was saying, the blades of grass. They like to keep on moving. So anytime there's any type of intestinal parasite, dogs treated, also making sure we're treating the environment is going to be a huge component.
I love that you're mentioning kind of the husbandry and cleaning piece because I do think there's a lot that goes into environmental contamination, the importance of, hand washing, disinfecting, even, food safety. Uh, I think that one thing that comes in with all of that is bacteria. I would love to hear you share about kind of bacteria in the GI tract. And obviously, cats and dogs have bacteria in their GI tracts that is good, but when does it become a problem?
Yeah, that's a great question. And it's something we're learning a lot more about currently. And we call it the GI biome or the microbiome. And, you hear all the talk about probiotics and prebiotics and things along those lines. The GI bacterial environment is really we're learning is quite critical. It's an important part to the gastrointestinal immune system, which is kind of an immune system all in itself, almost separate from the rest of our immune system as we think about things that fight flu or colds or things like that. And a lot of that bacteria lives in nice balance. And some of that bacteria is used actually in the digestion. So they are necessary to digest certain foods or certain ingredients and to provide certain nutrients for the body. And so it's incredibly important that we keep that healthy. And we've actually adopted the phrase, healthy gut, healthy body. Where it becomes a problem is when you have an overgrowth of one type of bacteria or another, or you have the introduction of a more infectious type of bacteria like Clostridium or something like that, or an overgrowth of Campylobacter or, E. coli. And, some of these bacteria, if you were to do a culture, you would normally see them. But if they become excessive, that's when you start to see problems. And that's when you try and balance it. And I just want to throw in a really important point here is, we're also recognizing the secondary effects of antibiotics on this bacterial environment. And I just want to throw out that, we're really starting to lean into a point where we're trying to lean away from antibiotics so much because we're recognizing that even after, single courses of antibiotics, it's changing that gut environment. And sometimes that can have further effects later on in life. And so I always really like to strive to my clients that, hey, I'm not going to prescribe antibiotics right away. It used to be everything went home with a tablet, everything went home with antibiotics. And we're trying to get away from that. So I'm trying to educate our pet owners as well, saying, you may not get antibiotics because it may not be necessary. And the secondary effects that we'll see could actually be worse than what we're trying to treat in the first place.
Yeah. Are there any like diets or environmental or husbandry issues you see that contribute to bacterial infection? Is that something that you see?
This is a little bit controversial, but we'll throw it out anyway. The topic of raw diets is always something that comes up when we think about bacteria. And I am not going to be one who says absolutely no raw diets. I have seen it work for some, work for others. I have my own personal opinions. But I feel like if somebody's going to do a home cooked diet or somebody's going to do a raw diet, they need to be educated and do it properly. You're not going to go to your local grocery store and just buy your packet of chicken and just feed it that raw to your pet. There's a reason we have to cook that, because there's the risk of salmonella and other bacteria. Get it from the butchers, get it so it's fresh as possible. It's not been prepackaged, anything like that. Obviously, I'll say my opinion is a nutritionally balanced diet that's pre-made is usually best.
Kayla, maybe you want to add, you have a couple of big dogs who I'm sure, like my dogs, probably are very curious about things like table scraps, very interested in what you're eating. What should people know about feeding, human diets to a dog or a cat?
Way back in the day, even maybe sometimes now, if a dog has an upset belly, we always hear bland diet. Give them, boiled chicken with some white rice and call it a day. And a lot of people are like, oh, well, I just gave him a piece of chicken. And I'm like, but you gave him a piece of chicken that was roasted with onions and roasted in all these different herbs. And well, maybe you didn't even cook it yourself. Maybe it was a rotisserie chicken, which love a rotisserie chicken myself. However, we know they're very greasy on the outside. Chicken skin has a lot of fat in it. And dogs just cannot, even cats, can't digest the way we can. And so those high fatty foods lead to GI upset, which then can lead to pancreatitis because their pancreas is not happy when it comes to high fatty things.
And I love that you brought up how the chicken is cooked, because I had a patient where I was treating them, they just kept coming in for this diarrhea and we just could not. And the owner swore up and down they only gave chicken. They were not feeding anything else, only chicken. And, we're doing probiotics, we're doing all these things. And I find them like, where are you getting this chicken from? And she goes, well, we go through the drive-through of, I won't say the fast food restaurant.
Oh,
and
no.
I order the grilled chicken sandwich and I take the chicken off and I give that to the dog.
No.
And I said, bingo, there we go. Always ask where they're getting things from. Just because they're saying they're feeding chicken doesn't mean what you think is chicken is what they're thinking is chicken.
Wow. What a story. Yeah. Please no fast food drive-thrus for your animals. So hopefully most people are feeding a proper cat or dog diet, but animals can still have sensitivities even to some of those diets, right?
Yeah, we're all built different. So I would say, some foods are going to work great for some dogs and cats, and some foods just aren't going to sit well with them. For example, one of my pets has to be on his own special little food just because he doesn't do great with any type of chicken-based product. And so he's just a little intolerant to it. It's, he doesn't have any crazy reactions to it, but you can tell his stomach's just a little off. His stools are a little softer. And so not all diets are going to work for everyone. And so just making sure you're kind of doing trial and error of, if you're going to be switching foods or you're noticing your dog or cat isn't doing super well on a certain specific food, kind of keeping an eye on of what's the main protein in the food, how much am I feeding, what are their stools look like after I feed this for a week, am I having to add anything into the food that could, a lot of people do toppers on top of regular dog kibble or cat. So just making sure, you're actually paying attention to what is happening after you give the food and exactly what are you looking for? Like, what do you want your outcome to be? And making sure, you're slowly switching foods and you're trying to make it work within the means of what works best for your pet.
Kayla, earlier you mentioned parvovirus, and I want to make sure that we talk about viruses that can impact GI health. Can you walk us through some of the major ones and how people can avoid them?
So there's definitely, lots of viruses that cats and dogs can get that are completely preventable. Using parvo is going to be our best example because I think that's one that people frequently hear. It's very, very scary. And so thinking of parvo, all it is there's vaccines for these types of things. And so we want to make sure that people are aware of preventative care, and access to preventative care is huge. And so making sure we're getting these puppies, we're vaccinating them at an appropriate time, even adult dogs, making sure all of our puppies and dogs and cats are all vaccinated at the appropriate times. They're getting their booster vaccines. We're making sure we're not bringing these unvaccinated animals to areas of areas like dog parks that could have animals that may or may not be vaccinated. We're not trying to expose them to these types of viruses to hopefully prevent them from getting them in the future.
We've talked a lot today about some of the kind of acute causes of GI stress. And before we wrap up, I want to make sure we talk about chronic disease. This is something that I've personally experienced with my beloved cat, Coco. She was an IBD girl, and in her last years of her life, she did have GI lymphoma. And I remember when she was diagnosed, I was just so terrified, like, how is this going to go? She actually lived several years, really, really well managed. And I'm wondering if either of you have some words of encouragement for people who are battling kind of more chronic GI disease, to encourage them that you can get through this.
I would say for, these pets that are getting diagnosed with these chronic GI conditions, I personally, our first Rottweiler, Mocha, she was very, very sick, and we were having such a hard time trying to figure it out. After lots of diagnostics, we realized that she had IBD. And, it is a pretty heavy diagnosis. And, especially with cats, GI lymphoma is one of the most common GI issues we see in our older cats. It is discouraging as a pet owner because you're like, did I do something? Anything that I caused? Was it not the right food? Was I not feeding? All of these things go through your head. These chronic cases with the proper care, can do phenomenal for a long, long time. Our dog Mocha, she lived as if any other dog normally would, and didn't have any GI symptoms once we were able to get her on the proper diet, and use the proper supplements and some medications added in. And the only time that she would have flare-ups is when some family relative at a holiday gathering would sneak her something, even though there were signs on our front door like, please do not feed the dog food. But it is scary, and it can feel like you're in a little bit of a dark place for a second, but it definitely, there's great outcomes, and they have lots of wonderful days left, and, years left. And try to stay strong and just remember you're here for your pet. Educate yourself with your veterinarian, and it's gonna be fine.
Okay, so let's say that somebody is listening to this. They realize, okay, I'm going to go in and have a vet appointment because my cat or dog is having GI issues. Kayla, what can they expect from that appointment? If they come in and see you, what kinds of questions are you going to ask? And what kind of diagnostics are typically going to be done?
Yeah. So, our goal is to be able to figure out what's happening at that moment and a history. So, history is going to be huge in this case because we want to know maybe some factors that could be causing the GI upset. Did they eat anything they're not supposed to? Did you change the diet? Is there any new additions to the household? Any new pets? Have they gone anywhere they don't usually go? Anything that could kind of trigger us to think, kind of lead us down a path, I would say. So, diagnostically, depending on the history, let's say we don't have any at this point, I would say we start with a physical exam. Then I would say, we're definitely going to be wanting to run a fecal sample, rule out any type of GI parasite. We're going to be wanting to rule out some type of foreign body or some issue internally. So we do some x-rays. Giardia snap is usually pretty high up on my doctor's diagnostic lists, just because on a fecal smear, we usually aren't able to see Giardia because they're quite small. And so we have a fancy little snap test that'll help us out with that. And then usually from there, depending on what those results are, maybe some blood work will get thrown in there, and then kind of see where our paths are leading us. Fingers crossed they're a little smaller by the end of all of that.
Sure. Dr. Carl, anything to add about like the diagnostics you typically find yourself doing? And also, when are you bringing a GI diet into the picture?
I say if we're showing any kind of a GI sign, I bring in a diet from the very beginning because you want to start that support. And like I said, a healthy gut, healthy pet. And so if we can get the nutrition back on track, that's going to really help us out. As far as diagnostics go, again, it really comes from, I'm going to look at the age of the pet. I'm going to look at, what was that history? Is it if it's a Labrador who's off their food, I'm going to be a lot more concerned because labs are never off their food. Also, bigger dogs, I might be a little bit more concerned about foreign bodies. So did they swallow a toy? So I might throw in some x-rays. What we do is based on that history and that physical exam is we'll prioritize those diagnostics and we may move those around depending on what we're seeing.
I love everything you shared. And I think this is why I always feel like the animal's caregiver and the veterinary team are sort of like a team of investigators working together to get all the information and figure out like what's the next step. And so I definitely encourage listeners, if you have these questions, go out there and get the rest of your investigative team, which is going to be your vets, your techs. I really appreciate both of you for sharing everything that you have. And before we wrap up, I want to do a segment that we call Off the Leash. This is where you have a chance to share kind of a hot take or a surprising opinion, something unexpected that you've learned through the work that you do. So starting with you, Kayla, is there a hot take that you have about digestive health?
It's tough. So I wouldn't necessarily call it a full hot take, but I would say it's definitely something with some varying opinions within the pet world. I strongly believe, and it does relate to GI health, that all pets should be crate trained. And the main reason I would say this, especially for puppies when we're linking it to GI health, is going to be that foreign bodies. If I was to leave my pet home alone, not in her kennel, I would be missing quite a lot of things in my house. And unfortunately, she would be suffering for that. I think a lot of times people have a very strong opinion of crates are punishment. And so I think trying to change that of like crates are a safe space for our pets. And my dogs love their kennels. They get fed in their kennels, they sleep in their kennels, they run right to them. That's their safe space. And so, for us to utilize that as like a tool to prevent these types of GI issues.
Dr. Carl, do you have a hot take?
My hot take is don't underestimate reading the label on your pet food, because there can be subtle changes that you may miss. And I have a story where, I had a really good client. I mean, she brought her little Westie in, and Westies are known for skin allergies and food sensitivities and things like that. And she'd had her on the same food forever and suddenly started having all these GI signs. Every time I saw her, I kept asking, has there been a change? What else has she eaten? Is there something else? Nope. I've been buying the same food every time I get it delivered. It's dropped off. It's the same food. Even got to the point where I went in and did surgery to take biopsies of the intestines. Cause are we looking for like a lymphoma? What are we doing here? I will never forget the night she came to pick her dog up after surgery. She comes into the front door into the reception with this bag of food. Carl, I know what it is. You're right. There was a change to the food. And I was like, what are you talking about? She's like, I totally missed that instead of saying with soy, it now says with corn.
Oh.
And she completely just missed. There was one ingredient change. And so we got back onto the normal food and everything was fine. And I thought, had we discovered this earlier, we could have prevented having to go through all of these blood tests, surgery, biopsies, the whole thing. So don't underestimate subtle changes to their diet because that can have a big impact.
Well, thank you both so much for being here. I have learned a lot from you and I really appreciate your time.
Thank you for having us.
That's it for our show today. I think if there's one important takeaway from this conversation, it's that gastrointestinal health is really complex. It isn't something that you should have to navigate all on your own. Having the right veterinary team is going to help you investigate exactly what is going on. So whether you're noticing a one-off upset or managing a chronic condition, I hope this conversation has helped you feel more confident in what to look for, when to act, and how to be the best advocate possible. Thanks for tuning in, and I hope to see you next time on Not Just Fluff.